Okay, so here's the dilemma that we see all the time. Someone comes in to see us and we're talking to them about their medical history, their level of activity over the last 10, 20 years maybe. And the person will say something like, well, I used to run and I loved it. And I would love to get back to doing that. And since I've stopped running, I've actually gained a little bit of weight. My blood pressure's a little bit up. I've kind of lost some of the benefits of running that I enjoyed so much, even outside the physical, kind of like the mental. I used to take maybe a lunch break and I would go for a run and I'd come back and I'd feel so refreshed and continue to work in the afternoon. Or some people would be like, I used to get up really early and run, and that's where I'd do all my problem solving, and then I could just go into the day with less stress. I used to be a better person when I ran overall. But the reason I stopped running was because, and a lot of times as a healthcare provider, told me that is bad for my knees and that I would wear my knees out. And so I was getting a little bit of knee pain. I went to see a healthcare provider of some sorts, and they're like, have you ever considered maybe not running or trying some other sport because it's going to wear out your knees? So this is such a common thing. And kind of where I want to bring some perspective to this is that running, and not just running, but a lot of sports can have some wear and tear on your knees, right? You're using your joints. You're using them in the way they were designed to do, but they don't stay perfect forever, right? They have wear and tear just like anything in life, right? Just like if you drove a car or something like that, the car will show wear. It doesn't stay brand new forever, right? So the problem with this is when people stop running, their overall health starts to suffer, right? They gain weight, blood pressure goes up. They don't deal with stress as well. They're just not as good of a person. So I look at it like this, right? Let's say running or some exercise is degrading your joints to the point where you'll someday need a knee replacement, right? Because that's the one you'll hear a lot about, like, I don't want to get a knee replacement, so I'm going to stop running or stop exercising this thing that seems to bother my knees a little bit. But if your overall health decreases, that equation doesn't work, in my opinion, right? So like, this is kind of how I think of it in my own head, right? Like most people, I don't know what the average age of getting a knee replacement is. Probably someone on here could comment and tell me. But let's say you're going to get a knee replacement if you're a runner and you're staying active, and you get a knee replacement at 73. Whereas if you weren't running and being active, you'd get a knee replacement at 75. But leading into that knee replacement at 75, your overall health is worse with all those things. Maybe pre-diabetic, overweight, high blood pressure, cardiovascular disease, all those things. So for me, right, and what I tell most of my patients is like, I'd much rather move up my knee replacement a little bit and be completely healthy and doing all the things I love to do and being active and get a knee replacement a little bit sooner. So just think about that, right? When someone tells you to stop doing something because it's bad for your knees or bad for some joint, is keep that in perspective. If you stopping that makes your overall health much worse, then it's not really worth stopping. Now, that being said, right, like if you are having rapidly degenerating joints because you just kind of have a soft joint in general, or just more prone to that, obviously mixing it up a little bit's not a bad idea, right? It's like, okay, you know what? I enjoy running. It's my favorite, but I used to run 5 days a week. Maybe I'll only run 3 and add some swimming or cycling or play tennis or something like that in there. And that's not a bad idea either, right? So it's not like go crazy till your joints explode. Be smart about it. As I like to say, try to stay in the game as long as you possibly can. But the last thing I'd want you to do is stop completely. Because when we see those people, what happens is they do stop, their knees do feel a little bit better, but then when they try to again do something active, then their knees are actually worse. Because when they don't do anything, the knees actually become softer, so to speak. The pressure of doing the activity is actually what keeps your joints healthy. So think about that. If you're having some knee pain and you think like, maybe I should stop, don't stop. Keep going on some level. And if you need help keeping going, that's where we here at Mission Move can help you out. So just take that message. Let me know if you have any questions in the comments, and I'll talk to you again soon.